Tomorrow morning, 10 a.m. is when the Prime Minister is now going to be addressing the nation. And obviously, the only thing that anyone in this country is talking about today is what exactly is he going to announce? It's possible it could just be another task, but highly unlikely. We're all anticipating an extension of the lockdown in some form or the other. Now, obviously, none of us know what the Prime Minister is going to say, but if I was in his place, there would be certain things that I would state, and they would go something like this. First of all, if I was the Prime Minister, I would talk about the fact that the lockdown has been effective. 21 days of considerable hardship, which the people of India have put up with really good grace. And it has had an effect. The curve has flattened. Cases in India are doubling every 7 days now, not every 4 days. Less than 10,000 cases across the country, and that is good compared to what could have happened if there hadn't been a lockdown. So if I was the Prime Minister, I'd thank the people of the country for their cooperation till now. Then, if I were him, I would say that we will have to extend certain amounts of checks and balances for a further period of time, a full lockdown perhaps in red areas, medium lockdown in amber areas, and a certain amount of opening up in green areas, which would mean agriculture, farmers, certain select industries, start allowing the economy to get back into shape. And finally, the third message which I would put out if I was the Prime Minister, I would announce an economic package. 500,000 crores, something like that, maybe larger. Maybe he can leave the actual details to others, but say something about the fact that he will allow some money to flow into the bank balances of the poorest or the poor migrant workers and others. I would use the food that is lying in FCI godowns to be used for feeding the poor. I would announce working capital and some sort of loans for small businesses and others who are struggling. And if I was the Prime Minister, I would go out then and say, don't worry, like I said earlier, jaan bhi rahega, jahan bhi rahega. We will save your lives and we will also save the economy. Well, that's what I would say if I was the Prime Minister tomorrow morning. We will, of course, wait to see what specifically he does end up saying. Here's a look at all the headlines right now.
Prime Minister Narendra Modi will address the nation on Tuesday morning at 10 a.m. The nationwide 21-day lockdown to fight the spread of coronavirus comes to an end on Tuesday, and the Prime Minister is likely to announce a further extension of 2 weeks, as has been demanded by most states. It is, however, likely that Lockdown 2.0 will see some relaxation, as has been suggested by some experts and also Industry Ministry, to let some economic activity begin with reasonable safeguards. The Delhi government will implement odd-even rules in all wholesale markets in the country, under which traders will sell vegetables on alternate days, Development Minister Gopal Rai said on Monday. He said that the government has also decided to stagger the timings for the sale of vegetables and fruits in these mandis. Vegetables will be sold from 6 a.m. to 11 a.m. and fruits from 2 p.m. to 6 p.m. in all wholesale markets in Delhi. The decisions were taken at a high-level meeting chaired by the Development Minister. The government on Monday extended the regular visa and e-visa of foreign nationals who are stranded in India due to COVID-19 till April 30th. The foreign nationals are stranded in the country due to the 21-day lockdown announced on March 24th to curb the spread of the disease. Foreign nationals whose visas have expired or would be expiring during Feb 1st to April 30th can apply for extension online.
The Health Ministry in its daily briefing said over 3 crore people have downloaded the government's Aarogya Setu app, which tracks the movement of COVID-19 infected people. The central government reported in its consultation with states to make the Aarogya Setu app an e-pass for travel. The Aarogya Setu app is likely to be a green card allowing movement. India has taken a lead over global tech giants by releasing the Aarogya Setu app, with experts and multilateral agencies identifying it as a valuable breakthrough to prevent the spread of the disease.
नागरिकों के लिए एक आरोग्य सेतु एप्लीकेशन का भी लॉन्च किया है। यह एप्लीकेशन 11 लैंग्वेजेस में उपलब्ध है। इसके अब तक 3.45 करोड़ डाउनलोड्स हो चुके हैं।
The West Bengal government is not sending enough samples for COVID-19 testing, claims ICMR's nodal testing facility in Kolkata, the National Institute of Cholera and Enteric Diseases. Dr. Shanta Datta, heading the institute, said there's been a big drop last week since they didn't even have 20 samples to test per day. He added that sample collection has not been done as per the recommendation, hence the number of tests are also less. Responding to Chief Minister Mamata Banerjee's complaints about lack of testing kits in West Bengal, he said ICMR has dispatched 42,500 kits to NICED so far, and that 7,500 have been given to the Bengal government so far. As the number of coronavirus cases in India nears 10,000, the ICMR is considering pool testing of people with symptoms in areas from where no SARS-CoV-2 infections have been reported, in a move that will widen testing significantly and highlight the actual spread of the disease in India. Pooling of samples involves testing done in batches. When a pooled sample tests positives, then individual samples are assessed. Research shows that this method can be used to do up to 3 times as many tests with the same number of kits, an important consideration given India's population.
The Indian Council of Medical Research has sought letters of intent from institutions with necessary equipment and infrastructure to participate in a clinical trial to study safety and efficacy of therapeutic plasma exchange in COVID-19 patients. The Apex Medical Research body's invite was uploaded on the ICMR website. The project, called Therapeutic Plasma Exchange, is an experimental procedure for critically ill COVID-19 patients, which the ICMR said it does not recommend as a treatment option outside of clinical trials.
As it tries to prevent a second wave of COVID-19 infections, China reported the highest number of new coronavirus cases in nearly 6 weeks on Monday. Authorities reported 108 new coronavirus infections over the past day, including 98 among travelers returning from abroad. This is the highest number of reported infections since March 6th, when authorities reported 143 new cases. Having largely stamped out domestic transmission, China has been slowly easing curbs on movement as it tries to get its economy back on track. But there were fears that a rise in imported cases could spark a second wave of the pandemic, especially among Chinese citizens returning from abroad.
Spain eased its economic restrictions on Monday, allowing thousands of workers to return to their posts amid a debate between politicians, unions, and scientists over the risk of a coronavirus rebound. The Spanish government ordered the suspension of all non-essential activity on March 30th, which meant an almost total paralysis of the country's economy. The measure was imposed in reaction to the advance of the pandemic. A total of 166,831 confirmed cases and 17,209 deaths have been reported in Spain since the start of the outbreak, making it one of the worst affected countries in the world.
The World Health Organization has said that there are 70 coronavirus vaccines in development globally, with 3 candidates already being tested in human trials. As drug makers race to find a cure for the deadly pathogen, the furthest along in the clinical process is an experimental vaccine developed by Hong Kong-listed CanSino Biologics Incorporated and the Beijing Institute of Biotechnology, which is in phase 2. The other 2 being tested in humans are treatments developed separately by US drug makers Moderna Incorporated and Inovio Pharmaceuticals Incorporated, according to a WHO document.